You know, for years, doctors did not have an answer. Women would complain of low energy, weight gain, poor sleep, hot flashes. Many thought they were experiencing menopause, but were still menstruating. So in the last couple of years, there has been an answer that has surfaced: hormone imbalance. It is one of the main causes of premature aging and has been identified as one of the most common reasons that otherwise healthy women just don't feel well. Joining us now with more on this topic is Dr. Steve Jepson. Looking over that list of symptoms, I'm thinking this affects most women.
Well, I think if you're a woman in between the ages of 30 and 75, you're at huge risk for any one of those symptoms. And I meet so many women in that age group who have been to their doctors and have listed those symptoms. I mean, what woman doesn't have some fatigue and some unexplained weight gain that they're not complaining about? They're either told, A, that there's nothing wrong with them, or B, that it could be a hormone imbalance, but often they're handed an antidepressant rather than, which is just a Band-Aid for the problem, rather than trying to figure out where the hormone imbalance is and actually correcting the hormone imbalance.
And hormone replacement therapy is still very new. Why has it taken us so long to get onto this?
Well, you know, they've actually been doing some sort of hormone replacement since the 40s, but it's always been synthetic hormones that have kind of been developed over the years, and I think as time has gone on, we've figured out that natural hormones are really the key to unlocking the answer to these women's symptoms and to women's symptoms in general, and it can be fixed. I think that's the great message. Is a lot of women come back from their doctor's appointments disappointed because they're not given an answer and they have to continue to put up with the symptoms, but the message is that it can be fixed.
It can be fixed, and your office, of course, dedicated to helping women look better and feel better. And when I read that hormones can affect your aging, premature aging, can cause premature aging, how does that work?
I mean, that's one. Our office is an aesthetic clinic, and people wonder why we deal with hormones at our office, but women aren't going to look good on the outside if everything's messed up on the inside. And so low cortisol and low progesterone will cause the cells to die prematurely, will cause collagen to go away prematurely, and will make someone age prematurely. I notice that women who are just starting to go through menopause, one of the first things they notice is that their face starts to drop, and can do it quickly within 5 or 6 months, and that's hormonal. So
how do you test this? How do you determine if you yourself, if your hormones are out of whack?
The way that I like to test hormones is with saliva testing, and I think a lot of people have heard about saliva testing but haven't heard enough about it that they're seeking out saliva testing. But saliva testing is a wonderful way to test hormones, much more accurate than blood, and it's the way that I test hormones. And I forgot to bring the saliva kit with me today, but women come in and they just spit into a test tube, we send it to a lab, and we're able to actually test the exact levels of 5 different hormones. Often when women go to their doctors, they're told that there's no point in testing your hormones because there's nothing that we can do to fix it, or they're given a prescription for Premarin or Prempro, which have caused a lot of hubbub in the media lately because of potential risks with that. And so women aren't getting appropriately tested, when in fact with a proper saliva test, I can find out exactly what the levels are of 5 different hormones in your system, and then the hormones that are out of balance or low or high, we fix them.
And I want to talk about the individualized treatment because that's important, but first, what hormones are you testing for?
So we test 5 different hormones. I test estrogen. Low estrogen can cause hot flashes, depression, poor sleep. I check progesterone. Most common cause of PMS in women ages 30 to 45 is low progesterone. Most common causes of hot flashes in premenstrual women is low progesterone. I also check testosterone. Low libido in women younger than 50 is almost always caused by either low progesterone or low testosterone. In women over 50, it's always low testosterone. And then I check DHEA and cortisol, 2 important adrenal hormones that women have to have in a normal range in order to feel right, have the proper amounts of energy.
And of course, different levels are going to be the result for every different woman, and that's what the great thing is you can customize the medication for that particular person.
That's the beauty of this, is not that it's not one prescription fits all. A woman shouldn't walk out of a doctor's office with a prescription for 0.625 milligrams of Premarin, because that's not going to fix every woman. Every woman has a different hormonal problem and should receive a prescription customized for her. I use compounding pharmacies such as Jolly's Pharmacy and Sugar House to use a compound of natural hormones, progesterone, estrogen, that come from plant sources, which are the exact same hormone that you produce in your ovary. That's why often the term bio-identical hormone therapy is used for this type of hormone replacement. Suzanne Summers has talked about this to a fair degree. That's why it's called bio-identical, is it's the exact same hormone that's made in your body. It's not synthetic. synthetic, it comes from a plant source, and consequently there's fewer side effects, better effects.
Just working to balance out your body and your overall health.
Absolutely.
Dr. Jepson, thank you so much. Definitely a problem a lot of women can relate to. And if you would like more information about hormone replacement therapy and the saliva testing that we talked about, you can contact Dr. Jepson at 801-281-0022, or you can visit their website, which is utahhormonemd.com. And there's more about this on our website, including links to the information I just informed you about. Americans have either an overactive or underactive thyroid. That's the gland in the neck that produces hormones to regulate metabolism and stimulates almost every type of tissue in the body. But only about half of those people have been diagnosed, according to the American Association of Clinical Dermatologists. But many individuals who are experiencing obvious symptoms, fatigue, unexplained weight gain, puffy eyes, they're being told that they're just fine. So what's the answer? Dr. Steve Jepson is here to explain. This is an important topic because it affects so many people, and I think it's so confusing for women. They have the symptoms list by list, and they're being told you're okay.
Oh, I know that there's many women watching the show today who have thought that they have a problem with their thyroid, and they've been told by their doctor that it's fine. And so today we're going to talk about 5 different ways that the viewers can ensure that they're getting optimal thyroid function and making sure that their thyroid's working appropriately.
And the first step, you say, is to get a complete evaluation. What constitutes a complete evaluation?
Well, a lot of people, when they go in and get their thyroid tested, their doctor's going to test just one test, and that's called a TSH. And it's kind of a technical term, but it's basically just a screening test. It's not really a direct measure of the functioning thyroid hormones. It's a long-standing tradition. Most of us that do a lot with thyroid don't understand why that became so popular. It makes a lot more sense to test the 2 hormones that are actually functioning in the body, and that's called a free T4 level and a free T3 level. I personally, when I'm checking someone's thyroid, I check 3 different hormones, and based on those 3 different hormones, make judgment about a person's thyroid status. So the first thing is to make sure that you're getting a complete thyroid evaluation. A TSH test isn't enough.
Doesn't quite cut it. So make sure the doctor is checking 3 as you do at your office.
Right.
The other thing to consider is to get other hormones balanced along the way. How does this play into it?
And this is kind of a follow-up to our segment from last month where we talked about hormone balancing. Your hormones in your body work like a big symphony, and an orchestra playing a symphony, and they all have to be working together in order for it to sound right, in order for it to function right. If your progesterone, estrogen, or cortisol are out of balance, your thyroid will not work right. So if you have a normal thyroid hormone, and all 3 of those tests that I alluded to in the first point are normal, and you still have symptoms of thyroid disease, it might be that your progesterone's too low or that your cortisol's too high. And we can check that, and we can fix those. And if those are fixed, then the thyroid will start working normally.
It makes sense, and that's a great analogy, working as a symphony. You want your body to all work in sync. You also say to treat with the correct hormone as well, leading it off of what you just said.
Right. There's two hormones that can be used to correct thyroid deficiency. One's called T4, one's called T3. T3 is the active thyroid hormone in your body, but for some reason, doctors give most patients T4. Then it's up to the patient inside of them to convert that T4 over to the more active T3. A lot of people don't make that conversion very well for various reasons. Their bodies just don't make that conversion. Those are people that will have normal T4 and sometimes T3 levels, but their thyroid doesn't work as well on a cellular level because they're not making that conversion. So sometimes it's better to replace T3 rather than replace T4, and often when clients come to me, that's one of the first things that we do is change the type of thyroid medicine that they're getting.
And I'd imagine if their body's not making that conversion automatically, that's an instant fix for a lot of people.
Absolutely, an instant fix within weeks.
Another thing you say is to consider supplemental replacement.
Supplemental replacement with iodine, because iodine, your body makes thyroid hormone out of iodine, and in the United States we don't get very much iodine in our diet. In fact, that's why they iodinize salt, is to make sure that there's enough iodine to kind of keep your thyroid from growing large, and that's called a goiter. But sadly, that's usually not enough iodine to make sure that the thyroid's working optimally on a cellular level. In the United States, over the last several years, we've become more and more concentrated on taking salt out of our diet, and so consequently, most Americans are iodine deficient. So making sure that you have enough iodine will also ensure that you have enough thyroid, and so often I will give people iodine supplementation, but you have to be careful because it's not something that a lot of times you want to go out and do on your own, because if you take too much iodine, you can go the other way and you can become hyperthyroid with too much thyroid, and that will give you symptoms as well.
And finally,